Hi everybody. I wanted to do a little bit of ABG practice tutorial with you. A couple of the students in my clinical class have heard this spiel before, but it's always good for a refresher if you need to. So let's talk a little bit about figuring out ABGs and what that means for the patient. When we're looking at an ABG, what we're looking at is the acid-base imbalance within the blood system. So this is an example of your normal ABG. So your pH should be between 7.35 and 7.45. Your CO2 should be 35 to 45. Your bicarb should be 22 to 26. We're not going to worry for the purpose of this class about the PaO2 at this point in time. But we have 4 different things that we look for when we're trying to figure out what the patient's ABG is and what that means for the patient. So respiratory acidosis, this is actually pretty common. You'll see this quite often, particularly if you end up working in the ICU with patients that are on ventilators. And what this means is an excess of carbonic acid. It's easier for me to think of carbonic acid as your hydrogen ions. And what does hydrogen ions mean? When you have a lot of hydrogen ions within the blood system, it makes the blood system acidotic. And what this results from is the patient not breathing enough. So you're going to see this in patients that have something going on with them that's causing their respirations to go down. So that's going to be something like maybe sedation. It can be that there's on the ventilator, your respiration rate is set too low. It might be from a drug overdose. So what's happening is the patient is not breathing off their CO2, and that is causing that CO2 to build up in the blood. Now, the renal system has the ability to compensate, but it doesn't work quickly enough. So these patients end up going into respiratory distress, and we have to do something in order to help them. Something like maybe put them on the ventilator and adjust their respiration rates. Give them some bicarb, or there's a few different things that we could do. Now, the very opposite of respiratory acidosis is respiratory alkalosis, and that is the exact opposite. That means that there's not enough of the carbonic acid, so there's not enough of those hydrogen ions, and this occurs with hyperventilation. So this actually isn't too common in regular patients. You'll see this a lot in patients that are on the ventilator and their respiration rates have been set too high. All right, so we've got a high respiration rate. Anxiety, this is the patient population that you see that they're having an anxiety attack and you have them breathe into the bag, and the purpose of that is that they breathe in their CO2, their own CO2 that they just exhaled. So that's the purpose of them breathing into a bag. It can happen sometimes with CNS disorders, maybe patients that have been in an accident or have some sort of trauma in the brain and it's affected the center of the brain that regulates the respirations. And then, like I said, of course, mechanical overventilation. So this is pretty common. You'll see this, especially, like I said, in your ICU patients. So typically the treatment is just to fix that underlying cause. And what that means is lowering the patient's respirations or having them breathe into a bag. Now, when we get into metabolic acidosis, we're talking about an acid that is an acid other than carbonic acid. So the two that you're going to see is going to be your ketoacidosis, which is from your DKA patients, and your lactic acidosis, which is from the patients that are in shock. That's why patients that we suspect are going septic, we're going to check their lactic acid. That's what we're looking for. It can also happen in patients that have severe diarrhea, and that has to do more with getting rid of too much fluid. So it's not so much, too much of an excess acid as it is you don't have enough fluid in the body. All right, now one of the key things that you see within a patient that has metabolic acidosis is the Kussmaul respirations. And that is where the patient is breathing very deep and very fast. Those very deep, fast respirations. Now that's the body's attempt to compensate by breathing off CO2. But the problem is it's natural for the body to do that, to try to compensate, but it's not going to be helpful because the problem is you have too much of an acid that is not CO2. So the body's basically just doing whatever it can to try to stay alive, but it's not really going to help the patient. So when you see this breathing, it kind of gives you an idea that, the body is trying to fix itself, but it's not going to work. If we have a patient in DKA, then what they need is, of course, fluids and insulin. And if they're going into sepsis, then they're going to need antibiotics in order to reverse that. For metabolic alkalosis, this is going to be a bicarb excess. So this is your bicarb excess. And this is going to occur with a loss of acid. You're going to see this in patients that have prolonged vomiting, or you might see it in your GI type patients that have excessive gastric suctioning. So if you have somebody that has an NG to suction and it's been on for 2, 3, 4, 5, and 6 days, depending on whatever their medical diagnosis is, then these patients run the risk of going into metabolic alkalosis. So your body can compensate by trying to lower that respiration rate and help build up some carbonic acid, otherwise called CO2, otherwise known as hydrogen ions, in the blood system, but it's probably not going to work too much. So one thing that we've started doing at the bedside to help prevent this is we have stopped the continuous suctioning and moved on to the intermittent suctioning. So when you see patients that are on intermittent NG suctioning, that gives you an idea that it helps their body to be able, what am I trying to say? It helps to not prevent so much of a loss of that acid. So if you have the ability to print off this little ABG bingo, this is always a good sheet to keep with you when you're first trying to figure out how to learn about ABGs and interpret ABGs. There's also a little mnemonic that we use that's called Rome. And how Rome works is when you're doing your arrows to figure out your pH and your CO2 and your HCO3, otherwise known as bicarb, you're going to look at those arrows and see is respiratory opposite, metabolic equal. So whenever you figure out which one of these is causing the problem to your pH, you can look at the arrows and see if they're going in the same direction, it could be metabolic. If they're going in the opposite directions, it might be respiratory. So this is another graph that I like to use in order to try to help figure out where we're at on this ABG. All right, so with your ABGs, it's 3 questions, and you need to ask these questions every single ABG every single time. And that's going to help you to get proficient in interpreting your ABGs. So your first question is you look at your pH. Oops, sorry. You look at your pH. Is it acidotic, alkalotic, or normal? Second, you're going to look at your other values and determine, is it respiratory or is it metabolic? And what I mean by that is there an abnormal CO2? That's going to be respiratory. If your HCO3 is abnormal, then that's going to be metabolic. And we'll talk a little bit more about compensation and uncompensation here in just a little bit. So let's do our first practice ABG. For the first couple of slides, I'm going to keep this little box here to kind of help you out. And baby steps. We use baby steps when it comes to learning. After a few slides, we'll take this away and try to do it by memory. Excuse me. Okay, so the first thing we do, like I said, is you have to ask yourselves the questions. You always look at your pH first. All right, so your pH, is this 7.30? Is this low or high? So we can look on here and we can see that this is low. All right, and what does that mean? If your pH is low, that means it's acidotic. So we'll put acid next to there. Now we're going to move on to your CO2. Is that CO2 low or is it high? So we can see here that it's high. So that makes, what do you have if you have too much CO2? Too much CO2 is acidotic. All right, so we are going to put acid right there. And then we look at the bicarb, 24, and we can see that this bicarb is normal. So it's a two-part question. So we're going to ask ourselves, you know, the pH is the first part. Is the pH acidotic or alkalotic? And we can see here that it's acid. All right. And what's causing this pH to be acidotic? Well, it's not the bicarb because the bicarb is normal. And we can see that the CO2, which represents the respiratory system, is acidotic. So here we have respiratory acidosis. So let's sneak down to the notes and look and see if we're correct. Respiratory acidosis. So looks like we're correct. Now we're going to take the notes back off because we don't want to cheat. We have to do this the proper way in order to learn. All right, so let's move on to our next one. We've got a pH of 7.55, and we can see that that is elevated. So that is alkalotic. And our CO2 is 33, which is low. And a low CO2 represents alkalosis as well, because remember, too much CO2 is acidotic, too little is alkalotic. So let's look at our bicarb. Our bicarb, again, is normal. So there's that two-part question. What is your pH? It's alkalosis. And what's causing that pH to be alkalotic? It's going to be the respiratory system. Okay, so our answer should be respiratory alkalosis. So let's check the notes and see. Respiratory alkalosis. There we go. All right. So we're going to do one more real quick with our cheat sheet on there. All right, so what do we have for 7.50? Okay, that is elevated, which is our 2-point question, which is alkalotic. Our CO2 is actually normal, and then our bicarb is high, right? So high means alkalosis. And our bicarb equals a metabolic part of the body. So let's check. We should have metabolic alkalosis. Metabolic alkalosis. So we're doing good. Okay, well, let's go down to one. Let's try one that is without our little cheat sheet. So 7.32. We're going to do our two-part question. All right, 7.32 is low, and a low pH means acid. All right, so the second part of our question is acidosis. 34, that's a little low. But the problem is that a low CO2 is alkalotic. That's not acid. So that can't be causing our pH to be off. Now what about this bicarb, this HCO3 is 16. That's low. Well, a high bicarb is alkalotic and a low bicarb will lead to acidosis. So when we look here, this bicarb is obviously the culprit and causing our acidotic pH. So that's going to be metabolic acidosis. So we'll check the notes and see if we're correct. Metabolic acidosis. Now it says on here compensating. All right, so what does that mean, compensating? So we look at here, when we say that a pH is compensated, that means that it is back to normal. I think that my video is going to shut off here, so I'm going to stop it and restart back on this slide in a new video.